Iontophoresis. You may have heard of it, but you might not know what it is. If you'd like to learn more about what this is and how you can use it in your clinic and your practice, stick around because we're going to dive into that next. So what exactly is iontophoresis? So iontophoresis is the delivery of a drug into the muscle, joints, and/or subcutaneous tissues through the skin using a small electrical current. So what exactly do you use to deliver that drug through the skin? Well, there are a couple of different options. Generally, there's an E-stim unit, an electrical stimulation unit, that has a positive lead and a negative lead that is used to complete the circuit and deliver the drug through the skin and into the tissues. We'll talk more about that in a minute. Or there are some small patches that serve as a small version of that have a positive end and a negative end that, again, work in much the same way to push the drug through the skin and into the tissues. So here's one example of the small patch versions of the E-stim unit. Now, I will say that delivery time of the drug and the amount of drug that you put on the patch differs depending on the drug that you use and the E-stim system that you use, so that will all vary. Here's one example. This is an Activa patch IntelliDose. This one particular unit administers the drug over a 2.5 hour period, and it delivers a specific amount of the drug that fits onto the small dispersive pad. So you may be thinking, how does this thing work? Well, you're going to have to think back to chemistry. And if you didn't have chemistry, you may have to Google this. But anyway, we're going back to talking about ions, positive and negative ions. Remember the anions, cations, all the other ions. Anyway, we're just going to call them positive and negative ions for today. Two positive ions that are close to each other repel. Two negative ions that are close to each other repel. Ions of opposite charge attract one another. Ions of similar charge, or the same charge rather, repel one another. So this is the premise behind how iontophoresis works. So the drug is applied to the patch, and depending on the charge of the drug, the charge on the patch repels or pushes away the drug. And when the patch is applied to the skin, if the drug is being pushed away from the patch, it is being repelled and pushed into the skin and into the tissues of the patient. So what are the benefits? Why even use this modality? Well, iontophoresis can help to decrease pain and inflammation. It can help to manage scar tissue. It can help to decrease edema, and it can help to decrease muscle spasm, among other benefits that we won't go into in this video. But all this is dependent on the drug that is used with the iontophoresis patch. Now, there are a variety of drugs that can be used with an iontophoresis patch. Some examples would be analgesics or local anesthetics such as lidocaine, corticosteroids, certain anti-inflammatory drugs. So the goal of treatment, what you want to achieve, determines what drug you select, and then the type of drug that you use has a certain effect on the tissue that's being treated. So that's kind of how that works. And a side note, if you're a clinician that's wanting to use this modality, whatever drug you use with the patch, you're likely going to need a physician prescription to order that and to use it. So just wanted to put that in there to be ready for that. So who could benefit from iontophoresis? Who would be a good candidate? I'm really glad you asked that question, so I'm going to answer it now. Someone with pain or inflammation, someone who has scar tissue who needs more scar tissue management, someone with increased edema, maybe in an extremity. So all these are potential candidates for iontophoresis, given that there are no precautions or contraindications with this patient or any comorbidities that would warrant you to avoid iontophoresis. And you can consult the patient's physician for more information on that, because not everybody is going to benefit from this treatment and not everyone is a candidate for this treatment. So go ahead and be sure to consult the patient's physician before you administer this, just to clear it and be sure that there are no contraindications. Speaking of contraindications, here's a short list of some contraindications for iontophoresis. Pregnancy. Do not use an iontophoresis patch on someone who is pregnant. Don't use iontophoresis with someone who has a pacemaker or who has a cardiac arrhythmia, someone who has a metal implant, someone with a skin rash or a skin disease. That would be more of a precaution depending on the nature of that, and I would again consult the physician on that. And then the last one on the contraindication list, which may be obvious but I feel like we should discuss it, is an open wound or an open incision. Obviously you should not administer iontophoresis through any kind of an E-stim system over an open wound or an open incision. So one of the last things we're going to cover is who can administer iontophoresis. Obviously this is a modality or a physical agent modality. And I would say that in general, OTs and OTAs, PTs and PTAs can administer iontophoresis, but this is ultimately up to your state or practice area's regulatory guidelines. So be sure and look at the regulatory guidelines for your state or your practice area because some states require additional certification before a clinician can use certain modalities. So be sure to be in line with that, and if you're lined up with that, everything else should be good to go. And lastly, I would say that if you're a clinician looking into using iontophoresis, or if you're someone already using iontophoresis and you're questioning the validity or the efficacy of this treatment, or you're just wanting to know more about it, I would say read the literature. Whether you're an OT or a PT in practice, both professions emphasize the importance of evidence-based practice and having literature and evidence to back up your practice. So go read the literature, find some good, solid evidence, bring that to the table, use that as a reasoning behind your treatment so that when other coworkers or a physician or another therapist or your patients ask you what you're doing, how it works, and why you're doing it, you can have some solid answers for them. Hope this helped you guys, and we'll see you next time.